When we look at the monumental, multi-billion-dollar national legal settlements won against corporate opioid manufacturers and distributors, the public policy conversation naturally focuses on an immediate, highly visible set of medical strategies. We debate how to allocate funds to build new detox centers, purchase massive stockpiles of overdose reversal medications, or fund long-term housing initiatives for people currently navigating active substance use disorder. But according to a deeply moving, vital investigative report published by WHYY, focusing exclusively on active usage, completely leaves out the secondary casualties of this generation-defining epidemic. Across Pennsylvania, a powerful, grassroots network of grieving parents and behavioral advocates are uniting to deliver a massive wake-up call to state leaders, demanding that a distinct, non-negotiable portion of this massive financial windfall be utilized to establish comprehensive, statewide grief support and emotional respite infrastructure for the families left broken in the wake of fatal drug overdoses. To understand why this specific, specialized support is so critical, the report urges us to listen closely to the unique, devastating architecture of overdose loss. Advocates point out that losing a child, partner, or sibling to a sudden, fatal drug overdose is fundamentally different from a standard bereavement experience. Parents describe the excruciating reality of living alongside a loved one locked in a cycle of chaotic substance use as a form of absolute psychological warfare. For years prior to the actual loss, families survive with a severely dysregulated nervous system, trapped in a constant state of hyper-vigilance and permanently waiting on edge for a devastating midnight phone call. When the fatal day inevitably arrives, the resulting trauma is amplified by a crushing wave of societal judgment, isolation, and intense personal shame, causing relatives to retreat into deep silence and preventing them from authentically processing their underlying grief. The WHYY piece highlights that a brilliantly successful, real-world antidote already exists right in the heart of the state. In 2019, city social workers launched a pioneering program called Philly Heals, Healing and Empowerment After Loss, which stands as one of the earliest known municipal models completely funded by a city to provide specialized, zero-barrier overdose bereavement care. The program completely eliminates financial and insurance roadblocks, providing free, specialized peer support groups, creative writing workshops, and at least 10 intensive one-on-one counseling sessions with licensed trauma therapists. Remarkably, the program actively bridges the communication gap by partnering directly with the city's medical examiner's office, utilizing next-of-kin records to proactively reach out and offer immediate, non-judgmental comfort to families within the first few vulnerable weeks following a confirmed drug-related death. Ultimately, this community report serves as a major blueprint for structural empathy across the entire national landscape. While programs like Philly Heals have successfully wrapped their arms around more than 4,000 urban residents, families living just outside the city lines are frequently left to navigate this devastating, complicated grief entirely on their own due to a lack of coordinated local funding and aborted county proposals. True, systemic recovery demands that we stop treating the aftermath of addiction as an isolated, private family tragedy to be borne in the shadows. By allocating dedicated settlement dollars to expand proactive, mobile grief care and respite networks into every single county, we validate the profound pain of the survivors left behind. We ensure that as we fight to heal the front lines of the drug crisis, we are simultaneously building an internal foundation of hope, human dignity, and lifelong emotional resilience for the thousands of families fighting to rebuild their lives from the ashes. This crucial public health advocacy was originally detailed by WHYY, and you can explore the complete text and regional helpline listings through the official links in our show notes.